Hello again, this is Dr. Rodney Anderson here with my colleague Dr. Jim Hopper to answer 5 more COVID-related questions. Now, these questions that we'll be addressing today all relate to the COVID vaccine access and distribution challenge that we have been dealing with. I want to start just by acknowledging that this has been a really frustrating, difficult experience for all of us involved, and the goal of this episode is to try to provide a bit more clarity on where things stand currently and some of the steps Family Care Network is taking to try to address what is a very difficult, challenging situation. That being said, I will turn it over to Dr. Hopper for the first question.
Thanks, Rodney. Well, the first question is, why can I get an appointment at a local pharmacy and not at Family Care Network with my primary care provider?
Thanks, Jim. Several weeks ago, the State Department of Health made, and the federal government as well, made a decision to shift allocation of the vaccine supply to several mass vaccine sites that the state is helping prop up across Washington, as well as distribution to local pharmacies. And so the fact that the pharmacies now have doses reflects a shift in how the vaccines are being distributed across the state. And if you have as a patient have the ability to get the vaccine at a local pharmacy, we would certainly support that. Obviously, we would love to give the vaccines directly from our own supply, but our supply has been quite limited. Now, we have heard from the state that the influx of vaccines coming from the federal government to the state level is supposed to increase over the coming weeks, which we hope translates to an increase in doses being allocated to Family Care Network. All right, next question, Jim. How are patients who don't have access to the internet supposed to get information?
Thank you, Rodney. Well, it's true that most of our access is through electronic media. Having it that way frees up our staff to take phone calls from those who really can't use electronic media. Calling for information is an option, and our scheduling line is 360-733-1342. It's not practical for us to mail out information because our information changes so fast. We are working to get information out in all other forms, including on the radio, through the Bellingham Herald, through press announcements. And so we're really trying to get as much information to everybody involved as we can. Clearly, as we get more vaccine, that'll be much easier. Rodney, question for you. A patient asked, I tried to get an appointment, but the appointment's filled up within minutes. How am I supposed to get an appointment?
Thanks, Jim. So the challenge here with the vaccines and getting appointments is that demand so greatly exceeds supply. Family Care Network has somewhere in the range of 25,000 patients who meet current state criteria to be eligible for the vaccines. And the shipments we're receiving are on the order of a couple hundred doses a week. And so obviously there's a huge variation there. The challenge there is, when we create appointments for patients, having 25,000 patients log in to try to get 200 appointments, those appointments disappear very, very quickly, and a huge number of patients end up being frustrated. And I apologize for the reality of that situation. When these vaccines were first approved back in December, FCN sort of kicked into full gear trying to plan and prepare and be ready to administer a large volume of these vaccines. And we have invested a large sum of money and resources in that preparation. And at this point, feel quite confident in our ability to administer 2,500 or so vaccines per week if we had that supply. Of course, the limitation is that supply is simply not coming. And so the challenge for us is, our goal as an organization is to take exceptionally good care of our patients. That is the implicit contract in healthcare of what we do as physicians. But the tool that we need to do that, we simply do not have access to. Our commitment moving forward is that as quickly as that supply comes in, we will try to distribute that supply and administer those vaccines to patients. We have committed to the notion that prior to opening any online or telephone scheduling of new appointments, at least 24 hours in advance, we will send out communication to eligible patients to let them know the date and time which we will be open for scheduling. And our hope is in the near future, instead of offering a couple hundred appointments per week, we're offering a couple or several thousand appointments per week, in which case, obviously, accessibility improves for everyone. Next question, Jim. Why can someone who is 65 get an appointment before someone who is 82?
All right, Rodney. I think we just will continue to follow the state guidance on eligibility. We will continue to ask for more vaccine because when we have adequate supply, we have processes in place to give vaccine to larger numbers of our patients, and we'll get those tiers filled out. Rodney, last question for you. A patient said, I feel that Family Care Network has let me down. Why aren't you doing more to vaccinate your patients?
Thanks, Jim. That is a challenging question. To be honest, and from a personal perspective, I do think that I feel some personal responsibility for not being able to provide care to the level that we would like to provide that care. And I will attest to the fact that individually and as an organization, we have tried to do everything in our power to try to boost vaccine supply. I've had phone calls with the CEO of the Washington State Medical Association, spoken with the Department of Health that does statewide vaccine allocations, talked with Cairo 7 News and such, trying to spread the word and advocate for vaccine supply coming to Whatcom County and coming specifically to Family Care Network. The response I get all across the board is simply that the supply is limited and folks are doing the best they can. And so I'm not particularly interested in trying to allocate blame one direction or the other. I would simply say that the healthcare system as a whole is not well equipped to handle a vaccination effort on this scale. And so everybody involved is trying to do the best they can and trying to make the smartest, best decisions they can along the way. We as an organization remain committed to trying to do everything we can possibly do to get higher supply of this vaccine. And then, as I said, to get the vaccine out to folks as quickly as possible. And so at this point, unfortunately, we don't have the capacity to self-manufacture this vaccine. We are ready to give it. We have created the infrastructure and have the resources ready to administer it. And so my ask and request is just that we all try to be as patient as possible. Again, I don't want to diminish the emotional aspect of this is a life-threatening virus that we are all facing, and it feels like there's a life-saving vaccine that we all can't get our hands on. That is the reality of the situation. But again, there's a limit to how much we can do to change that in the short term. And so I would echo Jim's statements that the simple things we do to keep ourselves safe and keep our community safe continue to have immense value. And we as a community as a whole ought to focus on those things, not just for our own benefit, but for the greater good as well. So thank you for joining us for another 5 COVID questions related to vaccine supply and distribution. I just want to say again that the reality of this situation certainly touches close to home for me. My mother falls in the eligible age group, and she is an FCN patient here in the community, and she has tried the last couple of weeks to get an appointment with Family Care Network and has been unsuccessful because the supply is limited. And I have heard each week about how challenging and frustrating that is for her. And so I, again, want to just acknowledge the difficult situation and the frustration that comes with it. I do think there is cause for optimism on the horizon. The federal government has stated that there will be an increase in vaccine supply allocation to each of the states over the coming weeks and months. And obviously, as we get more supply, we'll be able to administer more out to our patients. And I would ask that we all are just patient and hang in there as best as we can through a really difficult situation, and would commit to everyone that Family Care Network is in this for the long haul. We are part of this community. Our employees, our physicians and employees are members of this community. We are your friends, your neighbors, and we will see this thing through until it is completed. If that takes 6 months, if that takes 12 months, 18 months, however long it takes, we will continue to commit the resources, the energy, the time, and the money to be prepared to administer this vaccine until every last patient is taken care of. So thank you for your patience. Thank you for listening to this episode, and we'll be back again soon.